you don't control research, that's what I'm saying, it can get out of hand and begin to do harm instead of good. And so the Helsinki Declaration, there are so many components of it. But what it says in summary is that when you want to think about the research you want to conduct, think of risks that research will bring to the subjects. Think of the burden and think of the benefits. The benefits must outweigh the risk. Think of vulnerable groups and individuals. And there are so many of them. Children are vulnerable. Prisoners are vulnerable. Pregnant women are vulnerable. Fetuses are vulnerable. They can't speak out like others. So it's wrong to go to prison and conduct a study or try a drug that is never going to benefit them. Maybe it's going to benefit the politicians or the rich men. If we do that, we're not protecting the vulnerable. You are doing that because they're incarcerated and they don't have the power to say no. It's wrong to try drugs, certain drug on children that you know is never going to benefit them. After you go and make money from the rich that can afford that. The other part includes scientific requirements and research protocols. Every research you want to conduct must present a protocol. You must write up from the title to the methodology to how you're going to sample all of that and submit to the ethical committee to review and give you approval or not. And the ethical review, each training institutions, community, nation should have ethical committees or institutional review board that review every single research proposal. They can give approval or deny approval or amend it. Privacy and confidentiality. When we do research, information patients and participants are giving us confidential, and we must maintain that. So it's wrong to put people's data on a flash drive and travel around the country or outside the country. That flash drive get lost and people have easy access to it and open it and they're seeing confidential information. They're probably seeing the name, the age, the HIV status, all of the things that people have given you in confidence. When we talk about research, there should be statements on how we are going to maintain people's privacy. Most research actually, there's no need writing people's name or address. You code those. So you can code numbers and say 001, you know that belongs to this individual, 002 and the rest of that. And with the technology, you can password that to your computer. So if you have a file where you put those data, that should be passworded so that people don't have easy access. Even if they see your computer, they shouldn't have access to those data because it can be quite damaging. Informed consent. Nobody should be coerced to participate in the study. You explain it, the detail, the way it is, and if the person says, no, I don't want to participate, you respect that. And that consent, as much as possible, should be written and signed. They also talk about use of placebo. Placebo should not be used if there are comparative drugs to compare. If you go back maybe for the Pfizer study and we have a standard antibiotic that is working, so it demands that you have to compare your new drug to that standard already. It's wrong to take your new drug and compare with a placebo and publish that it was better than placebo. No. So unless there is no standard already, treatment for that disease or for that condition, they cannot do a placebo control study. Post-trial provision. So most time in trials, people get free drugs. Maybe you are trying a drug for guinea worm or for onchocerciasis, and they are getting free throughout the period of the study. Helsinki Declaration also demands that after that trial, they must continue to get that free drug until their condition is fully treated. So you don't walk away, you collect your data, then you carry your drug and go away. That is wrong. The research, registration, and publication of dissemination of results. Every research, in fact, every clinical trial must be registered. There is a database. You have to register that so that the research committee can keep track on that as well. And when you have your data and your study is finished, you must publish and disseminate it. So you don't go maybe hide it or give it over to a company and sell it to make money. Output of research is to serve humanity. And finally, proven intervention in clinical practice. Sometimes there are conditions untreatable, there are no drugs. And if you have such conditions and you have what you think may work that have not been subjected to research, you can use that, but that will be under the advice of expert committee. And whatever outcome, side effect, whatever, so you're using that procedure or that medication that is coming up, you must continuously report that so that people can be aware. So institutional review committee, we've talked about that. They have authority to approve your protocol or proposal, to exempt approval. Exempt means that there is minimal risk. For instance, you want to go back to UNTH medical record and look at the prevalence of malnutrition over a period of time in the past. You are not dealing with patients now, so you're not likely to cause harm. You need to write the protocol, submit to them, but they can exempt you. I mean, there is no risk to anybody. You don't need, because you can't go back to people you've seen 5 years ago and start asking for consent. But they can also disapprove and say, well, this study doesn't meet the minimum requirement. They can also monitor it throughout the study and very quickly to say that if you're required to modify that study, you must always get back to the ethical committee. When I sit down with candidates and postgraduate examiners defending their thesis, a lot of time they've made corrections, adjustment from originally approved protocol without going back to get a fresh approval or modification from ethical committee of the institution. That is so wrong. Ethical approval is dated. A lot of them have time frame within which to do this research and what you're allowed to do and what you're not allowed to do. If you go outside that, you are really going beyond research integrity, and that's not acceptable. So let's look at some of the things we've been able to achieve through medical research in the last decade. Some cutting-edge research, and hope that will stimulate us to begin to think of what we'll do after leaving school in terms of helping out to improve our research process and outcomes. So artificial intelligence in medicine. As we all know, artificial intelligence tools that are now being used to analyze CT scans, X-rays, MRIs, images for lesions, or other findings that human radiology and human interpretation can miss. That's cutting edge. They're also being applied in early detection and diagnosis of many diseases. They can now even recommend treatment, so they can do all that and say, okay, well, we think this is the best medication, this is the best, that's the beauty. And also being applied into discovering new drugs. So that's one of the things that happened in the last decade. Genomics, another important area which is getting traction, which means the study of an individual's complete set of DNA, including how the genes interact with one another and with a person's environment. Genomics has enabled us to improve diagnosis, provide more evidence-based approaches to medicine and better decision-making. In future, actually, the field of medicine might be genomics. So you look at individual, you provide specific tailored treatment for that individual. So you have a person's genomics, the whole gene sequence analyzed. He has high blood pressure. You have known the gene maybe particularly attached to that kind of high blood pressure and this kind of drug that responds. So you do that and they say, well, lisinopril will work better for you. Nifedipine will work better for you. That's the future of medicine. And that's the field of genomics. Robotic exoskeletons. So when people have spinal cord injury, it is end of the world for them. They're going to be paraplegic for the rest of their life. But this technology is revolutionizing that. In fact, a tech company, work device, which has received approval from FDA. In 2019, a paralyzed man actually was able to move all the limbs and walk with the help of this technology. Virtual reality, the surgeons are finding this useful, but not just the surgeons, even in pain management, in physical cognitive rehabilitation, in mental health, and many more. So it's like computer game. In fact, what the surgeons do, for instance, now, you have a person, maybe want to do a brain surgery. You go through this, you wear it, and then, the patient wear it. That gives you access to the lesion in the brain, to all of that. You're able to even practice the surgery, virtually, before you can undo that physically. It has improved outcome. It has improved efficiency, not just neurosurgery, orthopedic surgeries, delicate surgeries, and more importantly, in pain management, in rehabilitation. People probably have had a trauma, post-traumatic stress disorder. When they wear this, you can gradually readjust them. Maybe somebody is afraid of height and or had a traumatic disorder. Wearing this and gradually desensitizing the person has found to be very efficient and very useful. Then we're also beginning to see wearable technologies, just the way we carry our smartphone now. In the future, we should all be wearing this as well. Like it's going to look like smart watches. And as you're moving around, it's tracking your health indices, doing your blood pressure, doing your ECG, all sort of things we do. And these readings can be used to make diagnosis of conditions. And if it's linked to artificial intelligence, as we said before, it can help suggest treatment that you need to take, even before the doctors can dictate. So you might be walking around and say, you go do your checkup, you probably have an evolving cardiac heart attack coming up. That's part of what technology is looking at and part of what medical research is looking at for the future of medicine. Regenerative medicine, promoting the move towards cell as a pill. You know, there are so many organs in the body that cannot regenerate. When they degenerate, that's the end of it. But this field of medicine begin to look at application of stem cell technology into medicine and being able to grow cells and organs and tissues again to replace damaged ones and aging ones. That's look quite interesting. Communicable disease is also not left out. We won't forget that Ebola have ravaged West African sub-region and has killed not less than 11,000 people in the region. But in 2019, a vaccine was discovered for that. The HIV pandemic, where I spent so much time working on, when that disease started earlier 80s in US and spread around the world, it was a death sentence. I remember as a medical student, one of the first patients we saw, I think he got it from transfusion, and the dad was asking us or asking me as a poor medical student, is there no drug we can inject this boy so that he can die? So it was that bad that when people contracted that virus, it was seen as a death sentence. But research provided antiretroviral therapy, highly active antiretroviral therapy that reversed. And today, people are infected on medication, living about their life, getting married, having children that turn out negative. That's the beauty of research. While we've not been able to get a vaccine against HIV, at least we've been able to move it from a very catastrophic disease to a chronic manageable ill health. I remember COVID-19 recently. The vaccine, due to research, we opened the world and we can be able to move around again. I mean, if the vaccine didn't come up, maybe we'll still be on lockdown. So these are the beauty of health research. And the message is that there are still grounds to break. And I'm sure and I believe that people that will be breaking ground are listening to me this evening. Having said that, if we come down to sub-Saharan Africa, to Nigeria, it hasn't been that wonderful story. We have not sufficiently pulled our weight. In fact, we contribute just about 1% to research around the world. Our undergraduate training have focused on getting graduates as clinical doctors with little effort on research, which is why webinar like this should not just be a one-off thing. We do hope that we continually have this kind of interaction and build our skills further. So we should do both clinical training and training in research as well. We're trying through community medicine, but we need to do more and mainstream research into our training. And when we want to get started with research, I mean, the question listening yesterday, you're here again today. I'm interested in research. What do I do? How do I move the process forward? It starts with a concept note. It starts with an idea. And the first thing about concept note is that you need to have a title, a topic. And how do you get title, a topic? Sometimes my resident, elsewhere, and when I move around the country, asking me, my dissertation, I've not been able to start because I've not been able to get a topic. There are many ways. Interest. What interests you? What have you observed as you attend ward round and clinics? What are the gaps? What are the gaps in the literature? What arouses your curiosity? What are the problems that have defined solution? And you're beginning to think through, how can I be a solution to this problem? That can give you an idea of a research title. But the best way to actually get an idea is to read. When you read a lot of literature, a lot of publications, oh, they did this in India, but they could have done this. I'm going to do it here in Nigeria. Oh, this is a very nice paper from Turkey. They were able to do this, they were able to do that, they were able to, why didn't they do this? That becomes a gap in literature. You can take it further and say, let me study this, Okay, they did this in US, but they were Caucasians. Could it be different if we be here in Nigeria where we have blacks? That could be a gap in the literature you want to address. So these are some of the ways to think through and get a research topic when you're interested. And the next is the introduction. You need to write an introduction. An introduction should be about what is already known about the topic exciting you, and what are the gaps in the literature, and then how do I justify this? So, I mean, we've spent decades managing HIV and AIDS, but there's no vaccine. So somebody can want to conduct a trial on a vaccine and say, okay, what? Here we are. This is the disease. It started so many years ago. So many number of people have been infected. So many people have died. This is the cost implication we've had. This is the antiretroviral work. This is the cause implication. But since then, there haven't been any vaccine. And vaccine is going to be a game changer. And this is what vaccine is going to do if we're able to do that. That's what the production look like. So it starts from what is known to the unknown, and you justify that. Then you must formulate research questions. Research questions keep you on check. Because if you have a research question at the end of your study, you look back and find out if your questions were answered or not. So that's the what, the why, the who, and the where. And it must be clear, it must be concise, it must be focused, and of course, arguable. So a typical research question might be, what's the prevalence of HIV among Nigerian youths? If you're taking that as your research question, that means you're studying the whole youth. You're going to sample the whole youth in Nigeria. Another one could be, why do youth from state A, maybe Enugu, have higher prevalence of HIV than state B in Ebonyi State? That's another research question. So at the end of the study, you can look back and find that you've been able to answer your questions. And from research questions, you can develop hypotheses. So we have the null and alternate hypothesis. The null hypothesis predicts no effect. So I can decide to do the blood pressure of doctors, male and female in Enugu. Null hypothesis will tell us that there's no difference in blood pressure of male and female doctors in Enugu. Or, if I'm using the continuous variable, so I'm going to be doing the analysis with the values as they are, the systolic as they are, the diastolic as they are. But I can also decide to define hypertension. So at the end of the study, I looked at the group, the proportion that their blood pressure is raised. So that can create a new research question and say, there is no difference in the prevalence of hypertension between male and female. So the beauty of this is that at the end of the study, I will look back to find out if my question was answered or not. Alternate hypothesis on the other side predicts an effect. So it's going to say something like, the blood pressure of male doctors differ from that of female doctors. So it's predicting an effect already. Or the prevalence of hypertension differs between male and female doctors. The good thing about hypothesis is that you cannot have both of them stay standing at the end of the study. So if the null hypothesis is standing, you reject the alternate. If the alternate hypothesis is standing, you have to reject the null. So at the end of the study, one thing will be very clear. It's either that there's no difference in blood pressure between male and female, or there is. So one of them will technically stand at the end of the study. Then the next thing is review of literature. Review of literature, both local and international papers, will give you an idea. And when we're reviewing literature, it's not just to read the papers. You have to sufficiently critique those literature. So critiquing means you're going to look at the fine details of that study and not just the numbers. So they will tell you that in state A, the prevalence of HIV among youths was 60%. So you won't go around, singing and dancing. They have high prevalence here. Literature review demands that you take a closer look. How did they arrive at 60%? What kind of tools or tests were conducted? Did they meet the minimum standard for conducting tests for HIV? If they did it, why? And they're also going to be looking at the kind of people they sample. If they sample people that are higher risk of having HIV, it might not tell the whole story about that state. So if, for instance, they went to sex workers and sample them because of the particular risk, or they are sample people that are prone to blood transfusion, the risk might be higher. So these are the things you need to critique in that paper, why you think that prevalence they reported is very high. And when you finish your study, you have basis for comparison, with your own study as well. The objectives, you also need to set study objectives when you are writing your concept. And it must be smart, it must be specific, it must be measurable, it must be achievable and realistic and time-bound. For instance, I can say my objective in this study is, one, to measure the blood pressure of medical doctors in Enugu. Remember that this objective is different from maybe say to measure the blood pressures of medical doctors in UNT. When I say I'm going to do blood pressures of medical doctors in Enugu, what it means is that I'm going to have an idea all the medical doctors in where they work and the number there, and make sure that they're representative of the sampling. So if I end up going to UNTH and do the blood pressure of the doctors there, that's not blood pressure measurement of doctors in Enugu. But there are doctors in Nsukka, there are doctors in Ojiriva, there are doctors in Park Lane. So these objectives have this in mind. And I remember, recently I started examining a PhD student and a young consultant, and he did a study of looking at a type of nosocomial infection in his hospital. And it was observed that secretaries, cleaners, maybe, non-doctors, non-health workers were having higher prevalence than doctors and nurses. And the problem was the objective. The problem also was the sampling technique of that study. What he did was what was convenient for him. So he approached people can easily approach, which negates the principle of study. Easily, secretary people can easily fill questionnaires and then take their blood and measure. When you don't design a study very correctly, you're going to end up with wrong results and wrong interpretation, and that result cannot be generalized. So methodology is also important, and that's just what we're saying now. The design, you have to carefully design your study. And that's back to where we started. What kind of study is this? Is it a cross-sectional study, a case control study, a cohort study? You need to find describe the design of your study. Who are your study participants? We just talked about that. And very important, sample size. The sample size must be calculated. So you don't go a study and say, well, I'm going to take 100. How did you arrive at 100? I'm going to study with 1,000. How did you arrive at 1,000? The study sample size must be calculated so the study will be sufficiently powered. If you underpower a study, you're going to end up with wrong conclusion and wrong answers to your research question. And that's why it's important sample size calculation is done. Recruitment, including sampling techniques. So how are you going to sample your study participant? How are you going to recruit them into the study? If you do what my friend, I serve as a examiner is defense did, there'll be a problem. So if you have thought about you're looking for nosocomial infection in a hospital, it demands that you have an idea, all the people that work in that hospital, the health workers, including the doctors, the nurses, the laboratory, the pharmacists, and the non-health workers. What number, what proportion of each of those work in those hospitals? And make sure that they are proportionally represented in your recruitment. If you don't do that, you're going to again have a fault line. Inclusion criteria, exclusion criteria, who should be included in this study and who should be excluded in this study. Ethical consideration, we talked about the issue around the form concept, issue around all the ethics, ethical approval. You must obtain that from the Health Research and Ethics Committee of the institution. And they must be part of the concept note. Data analysis, how are you going to analyze your data after your study? You have to give a generic pattern and provide the tools, the statistical tools or tests you're going to perform in that study. Then the research proper, you go to the field, you collect your data, you have to, again, do the study proper, make sure data is collected, and then do data analysis, analyze your data. And part of it, again, is what you describe in your concept note. But you now need to apply statistical tests and statistical analysis on the data you collected. And statistics is not mathematics. You may maybe go back to doing the blood pressure of doctors, male and female. You find out that the average blood pressure of male was 140, that of female was 135. That doesn't mean that male have higher systolic pressure than female. That's mathematics. Statistics demands that you compare that. So you can do a t-test to compare the two. If it's statistically significant, the value will be less than 0.05. That's where you can now talk about being higher. If it's not, then what you saw is just mathematical difference, not a statistical difference. And then you can comfortably conclude there was no difference in systolic blood pressure of male and female doctor. Then you present your research results in tables, in prose, in graphs, and then you discuss your findings. When you're discussing your findings, you compare that with findings by others and allude reasons to why your finding differs or compares to ones previously documented by others. Then you conclude and recommend. Conclusion should go back to your research question. Are you accepting the null hypothesis? Are you accepting the alternate hypothesis? And the recommendation should also be based on the findings of your study. So you find out that male have higher blood pressure than female. So you're going to be recommending that male need to maybe check their blood pressure more regularly. So you can find male having higher blood pressure than female. I'm recommending that all doctors should routinely monitor their blood pressure or monitor it more frequently. It has to align to the study findings, then disseminate. There are many studies. Part of the reason why we stagger at 1 to 2% of the global research output is that we don't publish. If you finish a study and it's hanging in the shelf of your sitting room or your library, like many dissertations that get to happen around the postgraduate medical colleges in Nigeria, it's of no use, it's of no benefit. The world doesn't know about it. So a research is not complete until you have disseminated the information. You publish. And in the process of publication, you will be battered and traumatized. There will be rejections. There will be so many rejections. And I can't think of any academia, professor, that haven't had papers rejected by one journal or the other. But you don't stay rejected. When they reject, you blame for what they said. If they gave you some corrections to do or some comment, you apply that and move to the next. That's the spirit. And I put up this paper, I stumbled into this. 8 papers rejected before winning Nobel Prize. That's strange. So journals rejected these papers, and those research, medical research, particularly the one that caught my attention was, I think that's number 4, Yellow's invention of radio immunoassay in 1955. It was rejected by Journal of Clinical Investigation because people that reviewed the paper were skeptical that the letter in 1977. And not just this, so many others listed, they rejected at one point or the other by the journal they sent it to publish, but later was picked up for Nobel Prize. So I see a lot of people, academia, you get frustrated, well, I can't publish again, I can't write again, I can't research again. They never get to publish my paper. That's not the spirit. So challenges to healthcare research in a setting, especially developing countries like Nigeria. We have limited facilities of research education. I've said about that. We focus so much on clinical training, and research needs to be training as well. And in training research, you need to have the right facilities, you need to have the right faculty that also train the research so they can be able to train others. You need to have the tools, internet access. You need to have other facilities that enable research to happen. That is not very robust in developing countries. And there is lack of research culture. People move on their life. We can always import everything, including toothpick from China. So let China develop the vaccine, we'll import. Let India make the antibiotics, we'll import. At the background of so much corruption. So the politicians will rather spend money on frivolities, buy properties in Dubai and outside the world than to reinvest. Think about it again. US government invests twice Nigerian annual budget just on research. We need to wake up. And that takes me to the new point, limited funding and resources. So the priority is totally wrong. We need to reorder our priority. I mean, the future of any nation, not just in medical sciences, is about research. You have to be innovative. You have to think about problems and try to find solutions to those problems. And low priorities for health research is a no. We need to prioritize. When we look at the things we budget for in Nigeria, when we see annual budget being presented at National Assembly, is quite scandalous. Ethical standards, if you see this, the Pfizer example I said to us earlier, when we don't keep to ethical standards, because developing country is quite porous, people do so many things and get away with it. And even developed countries see us as a dumping ground. That's why Pfizer can leave US, New York, and come back and do that kind of study in Nigeria. So when the ethical standards, the institutional review board, the ethical committees are not strong in institutions to perform their roles, we're going to keep having challenge, attracting good research. And then limited access to health information. In some cases, it's even non-existent. So you pick up a health disease now and say you want to know maybe the number of people that have cancer registry in Nigeria. You might be surprised with the data, what you're going to have. Lack of collaboration opportunity due to different standards and the missing linkages between different levels and that linkages in terms of when we do those researches and we don't disseminate them, we don't put them to the policymakers, they're as good as not done. They are not changing policies. They are not changing anything. But there are opportunities we can leverage on. In sub-Saharan Africa, including Nigeria, we have a substantial number of patients. We have some diseases that are peculiar to us. Even the Caucasian are interested. Things like sickle cell anemia is basically a lot here in Africa, and we can leverage on that we have patients we can do research on. Most health problems like disease burdens and their determinants are still unexplored. And Africa have the market to do that. We have people that are enthusiastic like you now that want to be researchers, which should be encouraged. And your enthusiasm should not go down. You're on the right path, you're on the right direction, and you should pursue your dream. And then physician faculty, there are a lot of people around us, even in our teaching hospital, university, that have robust knowledge in research. We should pursue them, we should chase them. People are busy, but when they see your interest, they will find time for you. And that's happened around the world. When people know and value you, even in their busy schedule, they must create time for you. That's just what happens. And if you can't do randomized control trials because they're expensive, descriptive studies are not expensive. We can do that. Things we're observing around us, we can explore that. We can use well-designed questionnaire to gather useful health data that publish and is making sense, is answering a lot of research questions. Collaboration and partnership, especially in our time, is a global village we live in. If mountain doesn't go to Mohammed, Mohammed should go to mountain. Seek out collaborations when you're online, things fly advert. When I went to US for the scholarship program, it was a response to an advert. Put up your CV, put up what you have done, send it. It's not like Nigeria. As we are around the world, people do things the way it should be done. They will give you a fair hearing. They will look at what you are bringing. If you merit it, they will allow you. They will say, come, we can do business with you. And I encourage us, as we see opportunities, chase your dream. And they come, even sometimes unexpected. And again, another word of encouragement. Don't despise the days of little beginning. Seek out opportunities. And when you see the opportunities come in so many ways, when you see them, you grab them. When I was a senior registrar, and we have people from National Ministry of Health, those days the HIV haven't get more traction. So they came to Old South where we were, came to our clinic, and they wanted to ask us some questions. Everybody's always afraid of exams, including yours sincerely. And other people were running away, and that's okay, fine. The director from Ministry of Health, and they took us on what we know about HIV and what we, and all that. I remember the lady taking note of that. And in next training they had in Owerri, I had an invitation to attend as a TOT. And after that training, that's when I picked interest in HIV medicine. And that's opened the door to what I eventually did for my 3 years of career with an International Center for AIDS Care and Treatment Program based in New York. So what I'm saying, even what you're doing this evening, don't take it as a waste of time. Whatever knowledge you got, build on it, and then you're going to probably build in a career path that is opening up for you. And there are research groups we can also find around within the university and the hospital, and small grants. Every year, the African Research League, headed by one of our alumnus, provides small grant from students in the college to do and design research. I want to believe that what we have said yesterday, that you can be able to write a concept note. When that next advert comes up, I'm going to circulate it in our platform, and I want to see us apply. Give it a chance, apply. You never know. It's not much of a money, but when you apply that and win that, and you are writing for something higher in future, you're going to be quoting that I've been able to get this grant. And that's how we build career, step by step, one day at a time. And so what's the way to pursue your dreams? Start small, but set high goals. Leverage on technology. We all have access to internet. You can. I've done a lot of programs, so as a resident, we usually do research methodology. Took interest in statistics then. And after that, I did a master's program in public health, University of Liverpool. But all of that were never enough. So when I got to US, I started a research program and had at least a biostatistician working with. I took interest in developing my own skills in data analysis. After class with them, I go back, I have my set of data. I go back and open up YouTube, open up internet. And you'll be amazed. If you go back and try that this night, open up all of it. You can say, how do you code data? How do you do SPSS analysis? You will be surprised how simple these are. One I can see for it. But the message here is that technology is at your hand. Excel now, for instance, it's so many things you can do with Excel in terms of data analysis. Just go to internet now, Google, using Excel to enter data, to analyze data. And there's so many things you can do, and you can self-train yourself. When you have the opportunity to be the game changer, when you have competition, rather, that might be a game changer between you and other competitors. Seek for collaboration, continue to develop your research skills, be a good mentee. A good mentee is ever ready. If they give you an appointment for 7 a.m., you are there waiting at 6:55, and you never say no, you never take no for an answer. You're pressing, you are pushing, you are asking for more, and that's it. So to conclude on this talk, research has no doubt played a great role in advancing medical sciences, but there are still emerging and re-emerging health challenges threatening the global community. COVID-19 won't be the last. Before COVID-19, we had HIV pandemic, we've had re-emergence of tuberculosis. We thought we had control over when HIV resurfaced. It's going to happen again. So disease will keep re-emerging. And the world is waiting on you for answers to this problem. And you might be the next solution. So get started. And I want to thank you for listening. If you have questions, post on the chat, or you can raise your hand and ask within the short time we have. So these are the references. I will share the slide with us and we can read more of some of the things I said through the references. Thank you so much. So I open the floor now for questions.
Thank you so much, sir, for that wonderful presentation, sir. Having taken us through the itinerary of how research can be used in healthcare development. So over to our to our participants. Yes, Prof, everyone is quite happy and really, really appreciative of what you've rendered to us. So we are opening the room for questions. So if you have a question, you can raise up your hand, or you can.
Okay, Kokuvi Antonio. Yeah, so you can unmute and ask questions. Just to appreciate very quickly, the Association of Biomedical Science Students at University of Cape Town, Ghana. I just saw your chat. Thank you for listening. We are glad you're able to join us. And that's quite amazing. Thank you so much. Okay, so Kokuvi, you can unmute now and ask your question.
Okay, thank you very much, Prof. So I'm Antonio and I'm from Ghana.
Thank you.
Yes, please, I want to find out the weight that we are being compelled to do meta-analytic work. So I want to find out the weight that meta-analysis carry as compared to primary studies.
Okay.
And if meta-analytic works normally require ethical approval.
Okay, thank you very much. So let me put up this again. Okay, so meta-analysis has the highest weight. And the reason is very obvious. It's not just a review. Meta-analysis is different from ordinary reviews. So you can look at the literature and find something interesting, some previous work, and put them all together as a review. I've done that before, and interesting to give a perspective. So you can just say, well, malnutrition in Nigeria, the journey so far, and review literature on what's going on in malnutrition. That is not very weighty. That's lower down, such reviews. But review of randomized trials or systematic review, rather, has a very high weight. It's difficult to do. Again, like other study design, it's also difficult to design because there are also statistical analysis they're going to conduct in meta-analysis, in systematic review. What you are doing is that you're also going to be having inclusion and exclusion criteria. So you pick a subject of interest. Maybe you want to talk about zinc therapy and management of diarrhea diseases in children in Africa. You're going to search the internet for all the papers that have done work on this. That's all the trials on this. Sometimes I put papers in their hundreds. Of course, with your inclusion and exclusion criteria, you're going to finally select the ones that meet your inclusion criteria. Now, all of those sample size are going to be put together and reanalyzed. That's where we now talk about meta-analysis and that systematic review and give you a very high weighted evidence. What this does is that it cancels out by pulling all of those studies together, and you are canceling out the weak ones. Whatever the outcome of that reanalysis is going to be far weightier and heavier than individual paper. So if you take a single randomized control trial, it's enough evidence to change policy, to change treatment. But when you put so many of them together and reanalyze that, that provides a bigger evidence whether this should be continued. So if I've done a trial of zinc and I find it useful, and I'm using that, if I put all the trials on that together and do a meta-analysis and it's still very strong, very significant, it's a higher evidence. So that's what it is. And reason why it's at the peak of the pyramid. It's difficult to conduct, but if well done, it provides a very good evidence for the study. So whether it needs ethical approval, now the studies on individual studies have received ethical approval. In fact, in your inclusion criteria, part of the you may have set up is that you are looking at papers, you may be wanting to exclude those that didn't get clear about their ethical committee of the institutions, and that becomes exclusion criteria. So you have included all the studies that met the criteria, the minimum requirement for research. That takes care of ethical issues around that study. But if some of them require additional permission to use, these are people's intellectual property, you also make sure research integrity demands that you must follow through, right out to the authors and inform them that you want to include their study in that systematic review. I hope that answers your question, Anthony.
Yes, Paul. Yes, Paul. Thank you very much.
You're welcome.
Okay. Thank you very much, sir. We have some questions in the chat box. Chibikem Chidi is asking, what kind of research can are placebos allowed and not allowed? So what kind of, which researches do allow, make use of placebo, and which one does not make use of placebo?
So placebos are used in clinical trial. So they come under here. It's a highly valued study. So that's why if you're reading some papers, sometimes you see randomized placebo-controlled trials. Yeah, but remember what I said. What research integrity demands is that, excuse me, placebo should not be allowed in a study where there is an existing standard already. So if you have a new antibiotics, maybe a wonder antibiotics, we think is better in managing meningitis, we should not compare that new antibiotics with a placebo. We should compare that new antibiotics with existing standard antibiotics, maybe cephalosporin, just like the Pfizer group did in their study. So that's the rule guiding placebo. But placebo is allowed if there is no existing standard and you have a new drug to manage that disease. So I have a new drug for cancer, and there's no standard treatment for treating this cancer before now. This is the first drug that I have developed. Remember, by the time a drug gets to clinical trial, actually, it has gone through animal studies, it has gone through phase 1, phase 2, phase 3 trial, and gets to the time you are trying to a larger population. What it says is that if there is no other standard to compare, you can now use placebo. It cannot be a placebo, a randomized placebo-controlled trial. I hope that makes sense to you, Chibike. So you don't go using placebo in a situation where you have a standard treatment already, when you have a new drug. If you have a new drug, compare it with the existing standard. But if you have a new drug that there's no existing treatment before, you cannot compare that with a placebo. Okay. Any other question?
Okay, sir. Thank you so much, sir. Someone is asking, Esther Onyekachuku is asking, how can a student combine schoolwork and learn about research?
So I'm going to answer Esther rhetorically too. How can a consultant combine clinical work and teaching and administrative work with research? So Esther, to answer your question, you can, if you prioritize that. After you do research in your community medicine posting and you write thesis, I want to believe that still do that and defend that as well. But to be honest, it's difficult, and I get the angle you're coming from, but it's doable. And there are a couple of things that can change. One of the things that can change, as we said in the talk, is to begin to encourage it and mainstream it in our teaching. Then the other thing that can happen is that we need to free that time, just like your lecturers and consultants free that time. You can only free that time if your academic journey is within the progress it should be. Of course, if you have receipt to take, research shouldn't be the priority now. You should be how to deal with that and clear, because if you venture into that, you might have more way to deal with. But if you're on that trajectory, there are within the academic calendar periods that are less busy. What it simply means that you're going to work a little harder. And research is not done by one single individual. And any if a paper is published by a single person is questionable, because a person could have just sat back in the comfort of his room and cook up the data and write up the paper and publish. People have done that before, but consequences follow when they are found out. So what I'm trying to say next is, if we have a group, we can design small research that can happen, research that can happen within our school hours. I mean, somebody can have an idea and then design a questionnaire that can be shared online among colleagues. It's a research. They answer you that, you enter the data right in the comfort of your room, do the analysis, write up the paper. So when we talk about research, it's not only when we go to the village or travel outside our primary domain that research happens. Research can happen where we're in the classrooms, you see out questionnaires among your colleagues. Research can happen while the patients are waiting. But the point is that you must follow that protocol, get it written down, concept, get it approved, design the questionnaire. While we are waiting for your teacher to come to the class, you can do questionnaires and collect data that can form a research. So it's difficult, Esther, but it's doable. What it just requires is to create the time, and it happens. Now, the other thing I just want to say, maybe I hope promise for me to say that, I mean, he's a student, he has published a paper. When he brought it to me, I knew how busy I am. But one thing that made me to sit down and review that and give an input and help Promise was that Promise never take no for an answer. I said, Promise, I'm busy. I said, I'll call back. And he will call back later. Okay, Promise, I'm busy. Send the mail. He will send the mail. Okay, Promise, I'll be in the office by 7 a.m. If you can meet me there, we can discuss together. He's there waiting for you. And these are some of the sacrifices we have to pay. But nobody actually have the time. Everybody is busy. But as I said, when the seriousness is there, people will create the time. And where is that story in the Bible again? Yeah, the opportunity woman. She kept on disturbing the judge. I have to give her justice so that at least he can have peace of mind. Even if for that, you can say, okay, let me help this young man so that he can stop harassing my life. Thank you, Esther. Any other question? Promise?
Yes, sir. Thank you so much. We still have yes, sir. We just have a few minutes to allow for some questions. We have a couple of questions here. One from Benedict. Benedict Chidera is asking, Benedict Chidera is asking about how he or she can get research papers on cancer and infectious disease. How can one get research papers? What are platforms that one can get research papers on cancer and infectious disease? That's the question.
Thank you, Benedict. Yeah, I mean, this again, what I didn't mention when we were talking about challenges, when we thought about the limited research facilities. If you're in a typical university in the US, publications at your laptop desktop, because they are subscribed to institutional libraries, any paper you want around the world, and even back here in Nigeria after my stay there, when I need some papers I can't find, I usually write them and they download it and send to me. So that's a part of the limitation we have in the developing country, that sometimes things people take for granted elsewhere, they are luxury. But having said that, there are enough papers in cancer, infectious disease, good papers that are public domain, free access. All you need to do is to also be able, which is part of research. I hope we'll talk from those some other time, being able to know how to search using the search engines available. Where Google there too can be useful there. Enter the right keyword because it's actually garbage in, garbage out. Enter the right key. If you know what you are typing, select the right keyword and search. It will throw up a lot of papers for you. Then you carefully select peer-reviewed papers, papers published in journal, reputable journals. We didn't have time today to talk about different types of journals, but there are also predatory journals. There are journals hiding in India, maybe India, Nigeria, that collect money from people, so much money and publish nothing. They are not recognized anywhere. But again, there are still good journals that are online, open access, that you can have, good papers published there, you access and then read. And so one way to start, go to Google, search, put the keywords, search, look for peer-reviewed papers that are online free and start your reading. The thing that will happen is that as you are reading, they are referring you to other studies. You may want to access those studies. They are not available. Either they're asking you to pay money or they're asking you to register your university. So fortunately, we don't have most of those laws. But when you have that, you can approach some of the faculty members, lecturers have access to outside library. If you really have need for such papers and bring it, they will be more than happy to help out. And if I have access, why not? I'm more than happy to help get you the paper. Okay. Any other one?
Okay, sir. Thank you. We have we can just take about 3 more questions, sir. So I think I should ask the whole questions together so that we can tackle it together. So Jeff Bonzo is asking, does one need ethical approval for publicly available data? And that's the first question. Then the second question is, what are the benefits of publishing a research paper? Then the third person is Maduka is asking, what are there areas for research outside the medical field for non-medical students that are presently here with us? So he's trying to find out what other areas of research can a non-medical personnel fit into. So I don't know if you got the 3 questions, sir.
Yes, I did. And if I missed any, you remind me. So starting with the first one, papers that are on public domain, you don't need ethical approval. Ethical approval is when you are conducting a study. So when you're reading papers that are already in public domain, you are not conducting a study. You are going to be doing literature review of those papers. So what you need, they're in public domain, you review the literature. What you need is to reference them. So never in your career life as a researcher fail to reference an idea, a statement, a phrase borrowed from somebody else that's not originally your thought. If you do that, it will amount to plagiarism. And there are levels of plagiarism with far consequences. In fact, National Postgraduate Medical College, every dissertation candidate submit to us for examination, we pass them through plagiarism check, use what we call Turnitin. And there's a limit. If you cross that by, you can't even pass the exam. Is that important? Plagiarism is a whole different topic. We should never be caught up in that in our life as researchers. So when you have papers, you don't need ethical approval. What you need is to cite those papers, review literature, and make sure the authors are acknowledged, that you are referencing it, depending on whichever referencing style you are using in your write-up. That's one. Then the second one, non-medical people. Sorry, I didn't ignore you in this talk. Research is research. In fact, if you read carefully what we're saying, some of the things we said here are actually non-medical. In fact, the innovative things in medicine were not done by medical people. Some of them were tech-driven and sometimes working with medical people. One thing I learned earlier on in research, especially the time I spent in the US, was how research is collaborative. You work with a lot of people, the industries, whether they're big pharma industries or other industries that make products, whether equipment, hospital, whatever. You can generate an idea as a medical person, but you also need those people to make an input. And if we have different professionals in a research team developing proposals and working together, the outcome is usually a lot better. But people that are not even near medicine can also fit into research. There is no area of human life that you don't have research, even in social sciences, humanities. The only thing is that it will differ. If you go to social sciences, you might talk more about well, qualitative research. Why here we're talking about empirical studies, quantitative. So most of the research we are doing here now, for instance, might be dealing with numbers, the blood pressure, the sugar level, the age, the weight. Qualitative, even the social science, the behaviors, we do research there. The analysis become different. It's more like using different approach, your data gathering, key informant interview, for instance, focus group discussions. But they're still part of research. Even if you go to other forms of science, engineering, they're still science. In fact, those who have come back to the area of empirical data, because again, you're going to be collecting data, whether this tool is better than this tool. So those are part of what you also need to collect when you are conducting such research. So in every area of human endeavor, research goes on every day. And that's why even in university system, you can be promoted without doing research and publishing them, whatever discipline you're teaching. And for a university like ours, you just don't publish. You publish certain percentage of that paper in impact factor journal. And people in places like, well, of course, typical of Nigeria, most of our journals don't have impact factor, Nigerian journal. And people studying Igbo and teaching Igbo language ask, how do we now publish an impact factor journal, Igbo language, and get promoted? That's discussion for another time. So you can, in every area of human endeavor and life, actually do research. Remind me the third question. I think I forgot it now. Yeah, promise. What was the? I missed one of those.
Yes, the third question is about what are the benefits of publishing a paper, a research paper?
Okay, so there are so many benefits. And the first benefit is that research demands that you do that. You don't own any research work because it's not about you. You use other people's, maybe other people were participants in that study. So every research is to benefit the society, the humanity. And that's how we have all benefited, because people publish their work. So it's for the overall good of humanity. That moral obligation demands that we publish it, that you share your idea. And people can challenge that, reject it, interrogate it. That's also part of it. And when they do that, they should be able to bring superior argument. If you narrow down too, there are other benefits of publishing research. If you work in a university system, research is part of what you are needed to climb the ladder of career. As they say commonly, is publish or perish. So if you don't publish, you research opens door. When you publish your work and it's on public domain, people read it. People seeking for one information, seeking for collaboration. That's one way that can contact you. In fact, look at those, some of the people, your phone number. That can open door for contact. That can open door to industry when they're looking for people. They contact you. I do a presentation for a lot of companies, give talk. They see your work in online and read it and say, well, I'm interested in this area. How do I contact? They send you an email. Are you available to do this? So I can go on and on and on. So the benefits are there. I think that everybody in academia, students, faculty, should be able to get interest in research and run with it. Thank you so much.
Thank you very much, sir. And I must say, in a little addition to the last statement you made, I am very much appreciative of the last paper that we published. I can attest to the fact that I've been receiving emails on, where requesting for my presence to deliver a lecture or make a presentation. So it's still part of the benefit of publishing your research work. So thank you so very much, sir. Thank you so very much, Prof. And I think we have done a great deal of justice to the topic on how research can be used in developing the healthcare system, not only in Africa, not only in Nigeria, in Africa and across the globe. and you have given us a top-notch understanding about research proceedings and starting from the scratch. And I believe that our participants have been impacted with the full dose of learning today, starting from yesterday. So we really appreciate you, and also appreciate all our speakers, Professor Ifom Okoye, our speaker from Nigerian Medical Association Research Committee, Dr. Samuel Otene, Professor Wasoro, and every other personality that had graced this platform in order to see to the effective execution of this particular process. Thank you very much once again, sir. The participants are very much happy, and we are also indebted to you for having made this available, for having made this process possible to come to pass today. Thank you. And we also thank our participants. Thank you so very much for joining. I can see many of us are requesting for the slides, and most definitely Prof has made the slides available. All other slides that have been presented will be shared to us, and we urge us all not to just leave whatever we have learned just on the platform. Let's go a little step ahead to start engaging in some of these things. Thank you very much. And then I'm going to invite my Director of Health, Comrade Odokoro Michael, for a word or two. Over to you, Dr. Comrade Odokoro Michael. Okay, information reaching me now is that he's currently a little bit indisposed. So, Dr. Ogamba, our partner, please, a word or two for the participants. Over to you, Dr. Gamba.
All right. Good evening, everybody. I don't know if I'm audible enough. Promise.
Yes, we can hear you, sir.
All right. I don't know. I'm basically overwhelmed. I don't even know where to start. But let me start by thanking God for a day like this. This is like the kind of programs I wish I had access to as as a medical student. To spur my interest in research and perhaps usher in some opportunities for me to begin to actually engage in research. So I'm very happy for everyone who was able to make it to this 2-day program. And then I want to especially thank my father and my teacher, Professor Obesie. He's been here for it is almost like 2 hours now. I think 2 hours talking to us, and I know if we allow him, he will continue. So he's actually someone that I really respect so much and I value so much. So thank you very much, sir, for everything you do.
Thank you.
For how you invest your time, your resources in those of us that are still trying to come on. Personally, I pray that God blesses you and keeps you for us and continue to advance you all around. All right, so I want to encourage everyone who participated in this 2-day event. A lot were said. In fact, you cannot fully understand research just in 2 days. That's the truth. So what we're doing here and what we've achieved, I believe, is that we've been able to increase, or at least initiate an interest in research for a lot of people that attended, for the students and the young professionals that made that time to attend. It's a process. One thing I know about research is that it's a process. Okay, it's not something you rush. Okay, rush in the sense that it takes time to get the results, but you just have to be consistent. You just have to maintain your interest. You just have to build a network around people who are interested in what you're interested in so that you can grow. Because if you learn about research now and then you go back and maybe you don't, that's why we had a networking event on the group also, so that at least you can get to know people and get to know people that you can work with moving forward. So don't just isolate yourself. Okay, you can learn together, you can learn from other people and do something. All right. If you don't start, there's not going to be any result. So just give yourself a target between now and the next 6 months. Give yourself a target. If you don't start after 6 months, after 1 year, there is nothing. You will just end up attending another webinar, another research training, and continue the cycle like that. So I'm just encouraging us to go back and begin to implement. All right. I believe in results. So don't just acquire knowledge and don't just acquire skills and let them life follow. So I think that's all I have to say for now. So please, for the recordings, I think they've been made available, including the resources that were used these past 2 days. So just keep in touch, remain in the group, because there will be a post webinar training for selected candidates, people that will be, more mentored to move to the next level. So it's not going to be FP for everybody. So there'll be, just be on the group and you'll get further information on how that's going to happen. So thank you very much. It's been good having you all in this program, and good night.
Thank you very much, Dr. Gamba. Thank you very much for being part of this. So let me invite our host, Comrade Dr. Michael, to speak to us. Over to you, Dr. Comrade Dr. Michael. Can you hear us, Mike? We can't hear you, please. Okay, seems like Mike is experiencing some network challenges. I'm very much aware that he is sending his regards. I don't know. Okay, he's having some network issues. So in order to wrap it up, we are, once again, we thank everyone. So let's endeavor to keep in touch in the group, and most definitely there's going to be a post webinar assessment, and also there's going to be a Google form that will be shared in due course, so that we can in due time, and from then we will definitely be sending information across. So from my humble me, Okereke Promise Udochukwu, the chairman of this SUJ Research Committee, and together with my co-chair, Onwujekwe Ezenwa Maduka, who has always been very much pivotal to seeing that to the execution of this program. We are saying thank you very much, and to our speakers, once again, we appreciate. Thank you very much all for making our time to be here. And it's going to be a good night from us, although it's not going to be a goodbye, that is a good night. So from then, have a nice day to you all. Thank you so much for coming out today. Bye-bye.